I'm Eileen Doherty, Director of the Colorado Gerontological Society, and I'd like to welcome you to our presentation today on Medicare Advantage and Medicare supplements. As we begin today, I would like to first go through our navigation bar. So we are using the platform called Hopin. If you will see over here on the left, there's a big red one, and there is a red box around these different icons. Don't worry about the top one, which is a wheel. That is Hopin's logo. The second one is a little house. That is the reception area. That is where you are when you first enter the Hopin platform. The second one is a camera, which is the stage. Excuse me. And the third one is a little tent, and that is where the expo is. So let's go over here to the right, and there is a big red 2 with a box around chat, polls, and people. Chat is how you put information in if you want to talk to us, if you want to ask us a question, or you want to make a comment. You do that in the box down here on the bottom and the 3. So let's go to the next screen, which is the stage. And as you can see, the little blue camera came on. It says stage. We can over here use the same process if we want to talk to someone while we are on the stage. We can put our information into the chat in the 2 box. As you can see, somebody started making comments already, and you basically type into number 3. When we are on the stage, basically where you see my picture at the moment, we will start to see my picture and the slides for the presentation. When we finish with the presentation, we will go to the expo. This is the tent-looking icon. This is the outside of the expo, which is the logo for the Colorado Gerontological Society, the logo for Humana, and the logo are outside of the exhibit booth for Integrity Insurance. If we click on those, we will go to the inside of the booth. And again, you can see the little blue icon stayed on. We go over here to the 2, and we see that this has now changed to booth, and it has chats and polls again. And if you want to talk to us while we are in the booth, you can click on the chat and type something in. The other thing you can do is you can click on the 3 here where it says start audio and video, and that will allow you to either listen or to talk or to put information into the chat for talking with exhibitors during the expo. The other thing you can do during this expo is that you can learn a little bit more information about our sponsors. You can request an event offer if you want, and you can also request additional information from the sponsors about their particular programs or programs or information. Our sponsors today are Kaiser Permanente, Integrity Insurance, and Humana. We also have our colleagues with us from the Centers for Medicare and Medicaid Services. And lastly, I will be at the Colorado Gerontological Society booth after we finish the presentation. With that, let's go ahead and get started for our Medicare Lunch and Learn session today. We are planning to talk about Medicare Advantage versus Medicare Supplements and the advantages of both of those different types of coverage. We are going to start with Medicare parts. Part A is hospital insurance. Part B is medical insurance. Part D is prescription drugs. And Part C, which is Medicare Advantage, is optional. The premiums for A, B, C, and D are paid differently. For Part A, it is paid for them for most beneficiaries because they've paid into Social Security and into Medicare. The Part B premiums are paid by beneficiaries themselves. Part C is optional, so you only pay a premium if you join and become a member. And Part D premiums are again paid by the beneficiaries to the prescription drug plan. The Medicare Advantage, or Part C, then, we're going to start with Medicare Advantage plans. And here's how they work. The first thing is that Medicare contracts with private insurance companies. These companies agree to provide the same services that original Medicare provides. The company negotiates a rate or a price for a specific benefit package with Medicare. They then receive a capitated payment every month for every member that they enroll. The insurance company then turns around and they contract with providers like doctors, nursing homes, hospitals, labs, x-rays. And they then set up a negotiated rate with those providers who agree to provide services for that amount of money. The insurance companies maintain pretty much total control over the benefits and the services that they offer. Medicare is not involved in that in any way. The plans are usually sold either by exclusive agents who work for only one company or by brokers who work for multiple companies and will have multiple products that they can sell. Medicare does have a fairly extensive oversight role in the sense that they will approve the networks of different providers, they approve the marketing materials, and there are pretty extensive quality assurance programs that the companies are required to participate in to ensure that Medicare beneficiaries get services. You can change companies every year if you want. You do that annually through the open enrollment period. Within Medicare Part C, there are different types of Advantage plans. There are HMOs, there are preferred provider organizations, there are private fee-for-service, there are special needs plans, and there are dual special needs plans. So what this particular chart shows then is we have the different types of plans that the insurance company or the Medicare Advantage plan can offer. Over here on the left, we have the different kinds of benefits and coverage. If there's a check mark in the box, usually what that determines is that the company or the plan offers those kinds of services. So, for example, in an HMO, in a SNP, or in a DSNP, you basically have to use the provider networks that they have available. Sometimes you can make your own referral to a specialist. Sometimes you have to have the company make that referral or the provider. So if you're in a PPO or a PFFS, you can go to a specialist on your own. If you are in an HMO, a SNP, or a DSNP, you have to have a referral. You can receive care sometimes out of the network for additional fees. You usually have to select a primary care provider. Most of them offer a prescription drug plan. Many of them offer limited vision, hearing, and dental services, as well as other screenings. Some offer other supports, including things like over-the-counter drugs, medical supplies, and continence supplies. The majority of Medicare Advantage plans focus very significantly on prevention programs. They also focus on chronic disease management and care coordination. That is usually part of their quality assurance programs that they have to report to Medicare. The premiums are lower usually in a Medicare Advantage plan. Some even offer a zero premium program than in a Medicare supplement. The plan is going to make both care as well as payment decisions rather than the Medicare approving that themselves. Most providers, or sometimes you will enter a plan such as a private fee-for-service where the plan decides what they are going to pay. You also have providers sometimes that will not accept those payments. A Part C basics then, let's look for a few minutes at the out-of-pocket expenses. In addition to a monthly premium, if it's not a zero premium plan, is that there is a copay for most visits to the primary care physician, specialists, ER, urgent care, inpatient hospital. These co-payments vary by company. They vary within different types of plans. They vary across plans as well. You have to pay in a Medicare Part C for the coverage for days 21 through 100 if you are in skilled rehab. You usually have to pay the 20% copay for most Part B services or the negotiated rate in some instances, such as outpatient hospital services. Some Part B services also have just a flat fee, which comes in up here with the primary care physicians. The prescription drugs also usually have a copay depending on the tier and the plan that you are in. Other things to notice or to know about is that the Medicare Advantage plans usually charge a set fee for days three or 4 days while you are in the hospital, but they do waive the Part A deductible. They also waive the Part B deductible by charging the copays for those visits. They have negotiated an annual out-of-pocket cap with Medicare. So once your out-of-pocket expenses reach a certain amount, then you no longer have to pay the rates, you pay a reduced rate. The agency or the Medicare Advantage plan can waive any prior authorization rules that Medicare may have imposed. You as a member can join or change plans annually between October 15th and December 7th. That is the point in time which is known also as open enrollment. If you have pre-existing conditions, a Medicare Advantage plan cannot deny you admission. You have to be admitted regardless. If the Medicare Advantage plan has 5-star rating, then you can join that Medicare Advantage plan anytime during the year. Otherwise, you have to enroll during the AEP. If you have a Medicare Advantage plan and you want to leave Medicare Advantage and go to a Medicare supplement, sometimes people encounter the inability to do that because the Medicare supplement does have the ability to underwrite you for pre-existing conditions, unless you choose to take that option within the first 12 months of being eligible for Medicare. The Medicare Advantage plans that are licensed to do business in Colorado are the ones listed in this graph. However, not every company offers services in every zip code, so you may or may not be able to take advantage of these services depending on the zip code that you live in. Now let's turn our attention to a Medicare supplement, which is sometimes also known as a Medigap. Some basics about Medicare supplements is that they have a guaranteed issue for pre-existing conditions within the first 6 months after enrollment in Medicare. They also have a guaranteed renewable, which means that regardless of how many claims that you file, how much money you cost the company, they cannot drop you unless you don't pay the premiums. All of the plans are standardized, so they offer 10 or 11 different plans, and those are all standardized as opposed to the variation that you see across plans in Medicare Advantage. The rates that are charged are approved by the Colorado Division of Insurance rather than by Medicare, as is done in Medicare Advantage. A Medicare supplement, if you purchase one, you are guaranteed a 30-day fully refundable premium if you change your mind. The submission of claims in a Medicare supplement, the physician or the provider submits those to Medicare. The claim then is paid and then automatically submitted to the Medicare supplement company for payment. And if there's any balance due, then the company sends a letter to the provider, and then the provider bills you directly for any balance. Another thing is that in a Medicare supplement, you can use any provider, any hospital, any doctor, any specialist, any nursing home in the United States, as long as they accept Medicare. Rates in a Medicare Advantage, in a Medicare supplement, are determined very differently than they are in a Medicare Advantage plan. So the company, the Medicare supplement company, the insurance company can use attained age, which means everybody between 65 to 69 is charged one rate, 70 to 74, another rate, etc. Or they can use a community rating system, which basically takes all of their beneficiaries, puts them in a pool, and comes up with an average. The benefit of that is younger people pay more, older people pay less. Or they can use issue age, and they basically standardize the premium at which point you purchase the Medicare supplement. They can also decide rates based on whether or not you're smoking or non-smoking, male or female, and where you live in the state. So different zip codes have different rates depending on where you live. The Colorado Division of Insurance basically sets loss ratios, and based on the loss ratio of a particular company, that is how then their rate is determined. Medicare supplements, as I said, have plans. They have all these standardized plans, which is A, B, C, D, F, F plus, G, G plus, K, L, M, and N. So those plans are standardized regardless of what company you purchase them from. They offer this group of services over here, or benefits on the left. As of January 1, 2020, Plan C, F, and F plus can no longer be sold. As of January 1, 2021, if you are in a C, you can change to a D. If you're in an F, you can change to a G. If you're in an F plus, you can change to an F plus. You have to do that between January 2021 to June 30th, 2021. There is a special enrollment period that will allow you to do that. The way that these different plans pay benefits is indicated by the different check marks or the percentages. So the Part A deductible, if you buy a Plan A, is not going to be paid. You have to pay it yourself. If you buy a B through G or an N, it is paid for by the company. If you buy a K, they pay 50%, you pay 50%. If you buy an L, it's a 75%. And similarly, if you buy an M, you split it 50-50. The co-insurance, which is what you pay for days 61 on in a Medicare, Medicare will pay days 1 through 60, except for the deductible. And again, all of them have to pay that. The B deductible is paid by a C, D, or I see there should be a check mark by the F and an F plus. As of January 1, 2021, no company will be able to sell a plan that has a Part B deductible as a benefit. However, if you choose to keep your C, F, or F plus, you should, or they will continue to pay your Part B deductible. What you should know with these companies is that because they cannot enroll new policyholders, most likely the pools, the insurance pools will decrease and the premiums will go up. Part B coinsurance, this is the 20%. As you can see, everybody pays some. Similarly, the excess charges, some plans pay, some do not. And the other one is the skilled nursing rehab benefit. So days 1 through 20, Medicare pays, or the Medicare Advantage plan pays. And then what you see here is for days 21 through 100, the 21 through 100 on a Medicare Advantage is out of pocket. On a Medicare supplement, either all or some portion of it is paid. We have special enrollment periods, which I just referred to a few minutes ago. It is called the special enrollment period for those people who are in a C, F, or F plus. Please take advantage of that if you are in one of those situations. You can also change within the company that you currently have, or you can switch companies and go to a totally different company. These are the companies that are selling a Plan G in 2021 in Colorado. As I said earlier, the plans are standardized. So if you buy an Aetna Plan G, or you buy a State Farm Plan G, or you buy a United of Omaha Plan G, those benefits are exactly the same, regardless of the company. So you will shop them on product loyalty as well as price. Sometimes people say, will my Medicare supplement pay, and how do I know? The answer to the question on the short side is if Medicare approves, the supplement has to pay, no questions asked. So let's take a minute and look at the approval of some of the Part A charges and what is included. So in inpatient acute care hospitals or mental health hospitals, the A deductible is your responsibility. But after that, then everybody has to pay for basically room and board, nursing care, and other kinds of hospital services, such as surgeries, intensive care, other treatments and diagnoses. Everybody who is in the Part A world has to give beneficiaries a notice of non-coverage. And what that means is that if they believe that certain procedures or certain certain treatments may not be covered, they will ask you to sign a form that says that you agree. If Medicare doesn't pay, you will pay the full price. Similarly, when they are ready to discharge you, they may use the same notice, or they may use a different notice, but they have to give you notice that services are being terminated. In the skilled rehab facility, as we said, days 1 through 20 are free, 21 through 100 have a copay, and after day 101, if you are in a skilled rehab and you still need skilled services, Medicare, Medicare supplements, and Medicare Advantage plans do not pay. You may still be eligible for some services if you are in skilled rehab, but those will be Part B services. The kinds of services that are paid in skilled rehab, again, are nursing and therapy services, room and board, social services, medications, medical supplies, and equipment. Similarly, they have to, in the skilled rehab, give you notice if they believe some services will be covered, and they also have to give you notice if they are discharging you. Under Part A for home care, this also requires a 3-day hospitalization, as does the skilled rehab benefit. There's no charge for home care services, but you do have to meet certain criteria, including being homebound, and your need for services has to be intermittent, meaning that you need less than 8 hours of care per day or less than 28 hours per week for a period of 21 days. This can be stretched over a 30-day period, and it can be extended for additional 30-day periods depending on the need for services. Home care agencies have to give similar notices for services that they believe will not be covered, and you have to sign, as well as discharge notices. The last service under Part A is hospice services. You do have to have a terminal diagnosis with a life expectancy of less than 6 months. You will be approved for a 60-day benefit, followed by another 60-day benefit period by a 90-day benefit that can be extended if your condition continues to decline. In a hospice, basically, they focus on comfort care, and that is provided by nurses, social workers, physicians, chaplains, and other home care individuals. They provide you with medical equipment and supplies. There is a 5% responsibility on the part of the patient for prescriptions and respite care. Hospices have individuals on staff 24 hours a day to provide support to both the patient as well as to the family. Hospices are also required to give notice of services that either may not be covered or if they are going to terminate. Let's look now at Part B coverage, which is the medical part. And these are in original Medicare, the Part B benefits. So as you can see, there's a wide number of benefits that are covered under Medicare Part B. The ones that I have highlighted in yellow are the ones that do not require a 20% copay. So if you are in a Medicare Advantage, these services will be provided at no cost. There is no copay and there's no 20% out of pocket. If you are in a Medicare supplement, if you have a Plan G, it will cover the 20% for all of these. And if you have a Plan G and you use the services in yellow, then Medicare pays those. How do we know if Part B services are going to be approved? So if they are services that we just looked at in the chart and you have paid your Part B deductible, or it has been paid by your Medicare supplement, then if you're in the Medicare Advantage, it doesn't matter. So basically, if we meet those criteria and we need to pay the 20% or the 15% excess charge, Medicare approves it, then the Medicare supplement will pay. We have a new app that Medicare has launched about a year ago called What's Covered, and it looks like this. You can download it onto your phone, either your iPhone, your iPad, or your Android phone, and it will give you information on cost and coverage and eligibility for Part A and B services. Kind of a handy little app to have if you're at the doctor's office and you're trying to decide whether or not you are going to have that procedure, if they're telling you that it might not be covered because they've given you one of these notices over here and you're really trying to decide if you want it or not. In order for the benefit to be covered, it must be medically necessary. A physician has to sign off that the treatment that is being used is following medically accepted practices and the diagnosis meets the current existing CPT codes. The next thing we want to look at a little bit is a comparison on a chart or two about what Medicare Advantage looks like versus Medicare supplements. So in terms of Part A, for inpatient, either hospital or mental health care, we looked at the deductibles. In original Medicare, they pay everything but the A deductible. Medicare Advantage has a flat fee. Part A has a deductible, and if you have Plan G, it's covered. Days 1 through 60 are covered by the Medicare Advantage plan, and a MedSup, it's covered by Medicare. All the rest of it, basically, if you're in a Medicare Advantage, it's out of pocket. If you have a MedSup, it's covered. If you have a Part B stay, which is at a skilled rehab facility, if you meet the deductible, days 1 through 20 are paid by the Medicare Advantage, assuming you use network providers. If you are in a Medicare supplement, it's covered by Medicare, and you can go to whatever facility that you would like. Days 21 through 100, the out-of-pocket, which is projected to be $181.50. If you are in a Medicare Advantage, that out-of-pocket is yours. If you are in a MedSup, that will be covered. And after day 101, nobody's going to pay. On the home health side, if you again have met the 3-day hospitalization, there's no cost to you. The Medicare Advantage pays the fees, and if you use the network providers, if you're in a Plan G, it's covered by Medicare. Hospice care, oftentimes people will disenroll from their Medicare Advantage and their Medicare supplement and go all the way back to original Medicare. If they do that, the hospice then care is paid 100%. If they have prescriptions or respite care, they're responsible for 5% out of pocket, and room and board is 100%. Similarly, if you decide to keep your Medicare Advantage or your Medicare supplement, you can see that some charges are paid by the Medicare Advantage or the plan, and some are out of pocket. On the Part B side, again, when we look at out-of-pocket expenses, we look at original Medicare and what your responsibility is versus Medicare Advantage versus a Medicare supplement. We look at preventive services, vaccines, wellness exams. Medicare doesn't charge you for it. The plan covers it. If you're in an Advantage plan, if you're in a supplement, it's covered by Medicare. All the rest of these charges, such as physicians, labs, x-rays, durable medical equipment, ambulances, ERs, you pay the 20% copay, or the 20% is your responsibility. Medicare pays 80%. If you are in a Medicare Advantage, you either pay a copay or you will pay a flat fee depending on their what they've negotiated with Medicare. You're in a Medicare supplement, all of that is covered. So that concludes our conversation today on Medicare Advantage and Medicare supplements. We will now turn very briefly to a discussion of Medicare Part D. Most Medicare Advantage plans have a Medicare Part D prescription drug plan embedded, so they become known as an MAPD, or a Medicare Advantage prescription drug plan. If you are in a Medicare supplement, you will need to purchase a standalone prescription drug plan. So the standard benefit for Medicare for 2021 that beneficiaries will be responsible for, so you'll be responsible for the annual deductible. You will be responsible for the initial coverage limit, which is basically $1,032 out of the $4,130 cost of prescriptions at the retail level. So that is when you go to the pharmacy or the mail order, and that is what those costs are. Once you reach the $4,130 of costs in retail pricing, then you go into the donut hole. There, again, you pay 25%. If you get a generic, you pay 25% if you get a name brand. When the price of your drugs of this 445 is 4130, and then the balance reaches $10,048, you have reached catastrophic coverage. This is all on the retail side. This is not your out-of-pocket. Then basically the charges for catastrophic coverage are as follows. If you're using generics and the retail price is under $74, you will pay $3.70. If the retail price is over $74, then you will pay 5%. So if your generic costs $200, then you will pay $10 for a generic. If you are using brand name drugs and the cost at the retail level is under $184, you will pay $9.20. If the cost of the name brand is more than $184, you will pay 5% of the retail cost. So if it's $200, you will pay $10. If it's $5,000, you will pay $250 for that drug. This is a list of the companies that are selling Medicare Part D plans in Colorado. Unlike the Medicare Advantage plans where they pick the specific zip codes that they want to do business, a Part D plan has to be available in every zip code in the state of Colorado. So regardless of where you live, it is available and the pricing is the same. The next thing we want to talk a little bit about is resources. And we have several ways that you can access resources. You can request a goodie bag by send us your name, address, and telephone number with an email to cogs@senioranswers.org, and we'll put one of those in the mail to you. If you have previously requested a goodie bag, they are the same, and you don't need to request a second one. Another set of resources that we have is Medicare on the Porch. This includes resources on Medicare, as well as other information offered by our organization. If you come to our office at 1129 Pennsylvania Street, or you go to Holly Creek at 5500 East Peakview Avenue in Centennial, you can simply drive by, pull into the driveway, grab a bag off the porch. You don't need to talk to anyone. You can do it very safely. And you can do that on November the 2nd, 9th, or the 16th. We look forward to having you pick up information. Other things that we have done to help you in this navigation of Medicare is we've set up a toolkit, and one of our offerings includes individual counseling. So if you have any questions about Medicare Advantage, Medicare supplements, prescription drug plans, you're new to Medicare, you don't exactly know what to do, you need help paying for your Medicare Part B and D premiums, any of those things, we have counselors who can help you walk through that and help you understand those different questions that you might have. We are also partnering this year again with the University of Colorado School of Pharmacy students, supported by faculty members, to offer medication management counseling. They are doing drug reviews to see that the drugs that you're currently taking, what their interactions are like, and to make recommendations regarding that. They can also do counseling on the various drug plans. Their appointments are available via Zoom, and we have a limited number of appointments available on November 4th and 5th. Call our office to take advantage of those. Other items in the toolkit are, we highly recommend that you use the Medicare.gov site. There's a vast amount of information, including the Medicare Plan Finder, which is the information that you will need to decide what prescription drug plan you would like to enroll in, or what Medicare Advantage plan you would like to enroll in. The Medicare.gov site also hosts the MyMedicare.gov account or your profile if you haven't already opened one up. If you have a Medicare card, or a Medicare number, please feel free to open one up. It helps you to track your various kinds of Medicare services. The last thing we have in our toolkit is the Medicare Drug Insurance and You Colorado newspaper that many of you use. We usually have hard copies of those available when we see you in person. There are online versions available at the Colorado Division of Insurance Senior Health Insurance Counseling Programs website. The link here in this PowerPoint works. They are also copies in both the goodie bag as well as Medicare on the Porch. Other things we have in our toolkit is you can visit our sponsors, Humana, Integrity Insurance, and Kaiser, as well as Cigna. You can go to their websites, or you can go to the expo following this presentation. If you're looking for a complete list of the Medicare supplements, Medicare Advantage plans, or Medicare prescription drug plans, again, go to Medicare.gov. They have a complete listing. And at this time, that is the end of this presentation for today. You can visit the expo and our representatives and sponsors there in the expo hall. Remember, all you have to do is go click on the little tent in the left-hand navigation bar that says expo. Click on the outside cover, click on the next one, and you should see the representative sitting on there. If you want to talk to somebody, remember to click on the right, make sure it says booth, and then type any questions that you might have. Thank you for your attendance and support. We look forward to serving you. If you have any questions, please feel free to call the Colorado Gerontological Society at 303-333-3482, or you can send us an email at cogs@senioranswers.org. Thank you for joining us today, and we look forward to serving you in the future.